let's try to get into the room and be seated as soon as possible. We have another really exciting session, but it's always a challenge. It's always a challenge to get the crowd away from sugar and caffeine into a room that's not well lit. So we appreciate the cooperation. And I also want to call on the speakers. If you're in the audience, please join me on stage. Josephine, I see you're here. Please join me on stage. Deputy Director General Thulani MAVUSO, please join me on stage. Mohamed MASSAQUOI, Sierra Leone, Ambassador. And Zeze Reed, please join me on stage. Actually, let's sit in the order. The first one is South Africa. You can sit here. Thank you, Josephine. Liberia, Sierra Leone. Liberia and Sierra Leone. Are you in the audience? Let me say a few words while we're gearing up to get started. This is a continuation of part 2. In the first part, we angled the session to be to address some strategic questions like the credential strategy, like the data protection and safeguards, like the citizenship and nationality. And in fact, the polls that came out and the information that came out, some of which were actually surprising, but they're interesting. They told us something about the sentiments in this room. In this particular session, which is a continuation of the first part, we are going to be addressing some other aspects of ID systems which are no less controversial. In fact, some of them are very controversial. So, but we should not be afraid to address controversial issues, because if it is unsaid, it will lead to confusion and it will lead to complications. I'd rather put it out there. So some of the polls that you're going to see today are going to have some controversial issues, but it's by design. I take responsibility for that. Anyway, so I think we have 3 out of the 4 speakers. The 4th, I see there will be on his way. We are going to start the lineup with Deputy Director General of DHA, Thulani MAVUSO from South Africa. We will then go to Josephine MUKESHA, who is the Director General of NIDA, Rwanda, and then Mohamed MASSAQUOI, who is the Director General of NCRA, Sierra Leone, and then Zeze Reed, who is the Deputy Executive Director of the National Identity Registration from Liberia. So, the rules of the game, Slido is operational. So all along, we're going to try to do our best. Any questions that rise in popularity, we may be able to take. We will do some polls, like we did in the previous one. So your participation is important. And each will get precisely 15 minutes to make their opening remarks. Then we will have a session of half an hour of discussion, question and answer from Slido plus polls. With that, I would say, without any further ado, I'd like to ask my good friend Thulani MAVUSO to present his slides. Thank you very much. Thank you for being with us.
Good morning. I hope everybody can hear me. I'd like to use this mic. If you could just switch it on.
Yeah.
Okay. No, thank you very much. I'd like, therefore, to start my presentation just to give some of the inroads that South Africa has made as part of ensuring that we manage our digital identity in a manner that is secure, but also is able to cover all the citizens. So this presentation just gives you an update on the progress that we have made by Department of Home Affairs in ensuring that we safeguard the official identity and the status of all the persons who are living in South Africa. These include the citizens, the permanent residents, and those who are here on temporary visas. So the mandate of the Department of Home Affairs is divided into two broad categories, which is civic services and immigration services. In that, we're looking at management of citizenship and civil registration. I think it's a critical area, the issue of civil registration, the management of international migration, and also the management of refugee protection. So just to give a bit of an history in terms of the evolution of our mandate in ensuring that we cover universal birth to death registration, is that since 1994, we have embarked on the process of ensuring that the population register is secured, and also that all the people who reside in the Republic are in the population register. In 1994, Home Affairs was formed from 11 different former departments in South Africa, because we had what we called Bantustans, which were regions in different parts of the country, to ensure that we deal with the issue of fragmentation and racial segregation. By the end of last financial year, we were sitting at about 21,806,000 citizens that have been issued with smart cards since the inception. As the DG was reporting earlier, that 21,000 has now become 21 million has become 24 million as we speak now in this financial year. So while we have made great strides towards ensuring that no one who lives in the country is left behind without a legal record of existence, there are still challenges that we are still dealing with of people who are not registered. There are still some weaknesses in policies and legislation that we are currently dealing with. That is why we have published recently a new white paper on citizenship, immigration, and international protection. But also, we've been confronted with a number of challenges. For an example, where we've been tasked with the responsibility to look at ensuring that the ID numbers that we currently have is a gender-neutral ID policy, and also the enrollment of minors to ensure that they secure their identity, the linkage to birth registration, and also identity management in rural areas and areas that have no internet connectivity, and also ensuring that onboarding of individuals with no proof of existence. So when we look at identity management in our country, it's quite central to many activities. For an example, if you look at the bottom there with the blue box, the IEC, next week, the Independent Electoral Commission is going to be conducting elections across the country. So central to the ability to vote is the issue of identity management. In other words, you need to be able to identify yourself through the ID. But all other services in the country are dependent on us being able to produce, whether it's healthcare. We are currently, President has just signed the National Health Insurance legislation, so therefore it will be central for us to enroll everybody in. So therefore the identity management again becomes central to all these other services. We've got various service delivery channels that we have actually introduced. There's the DG in his opening remarks made reference to our frontline offices, which are bricks and mortar. Some of those, about 204, have been modernized to be able to issue smart cards. We are dealing with the remaining ones because of the rural connectivity in some of the areas and also the space issue. He has also made reference to 161 health facilities where we are saying that no mother must leave the hospital without that child being registered. In South Africa, we've got 1,445 health facilities that have got maternity wards. Of that, about 346 covers about 92% of beds. So those 346, all of them are going to be having equipment to be able to register online. So we've got that 161. We need to cover the difference between 161 and 346. And then the remainder of that 1,445, we are servicing it through mobile visits in those facilities. We have taken an approach of saying that because we work with financial institutions like the banks, that they need actually to play a role in helping us to be able to convert every South African's ID to a smart card. So therefore we started a project with them to be able to actually have services located inside the banks. Say the project started as a pilot, so we're at a point now we know we need to be able to expand to bigger facilities. We're managing 72 ports of entry with the Border Management Authority, 32 missions abroad, where we are able to ensure that all those who want to visit South Africa are able to go to those facilities, and also those who are South African expats living abroad are able to get services, civic services in those countries. We have visa centers in the country and also refugee centers, and also, as DG has already indicated, we now have a project of Home Affairs on Wheels, which we have expanded to 227. So these are the channels that we are utilizing currently. So in March 2022, we submitted to Cabinet a new policy where we want to introduce a new identity management policy and a legislation. So the policy lays a foundation for repositioning the department as a sole official legal identity and status services for citizens and non-citizens who reside in the Republic. And this policy enjoins the DHA to also introduce some reforms. Some of the reforms that we are introducing in our legislation, one will be to ensure that every birth that is taking place in the country is registered, irrespective of the immigration and citizen status of a parent, in order to ensure that that birth is registered in the national identity system. Because currently, if somebody, for an example, gives birth in the country, they are not citizens, so we issue the proof of birth so that they can be able to register in their country, but we don't keep the record of that individual in our system. So that's what we want to do now. Also to ensure that all vital events like birth, marriages are also recorded. We currently record them, but there are some deaths that are not recorded. Also, we want to introduce non-binary transgender intersex persons. Alternative digit or the letter X will be used on the identity number. And also the new legal age for ID, we are going to bring down to 10 years. Because part of the problem is that we currently collect the biometrics when someone turns 16 for the first time to be able to keep their biometrics. That creates a problem for identity theft. So if we bring down the age, it will secure their identity much earlier. And also the draft policy that we have introduced, which has been translated into a draft legislation now. Obviously, with the elections coming, with the new parliament, we'll be introducing it to new parliament. So just to indicate also that as a department, one of the things that we have done is to ensure that in order to secure identity, we register all the births within 30 days. So we are registering about 800,000 births on an annual basis based on what the legislation provides for, and that project is actually going very well. So we want to also avoid late registration of birth, because if people come after 30 days, it's very difficult to make determination whether this child is actually of the same parents that they're coming to register. But when they register their child at a hospital or within 30 days, we're still able to deal with that particular issue. And the issue of what we call early birth registration, as the DG said earlier, is in line with the Sustainable Development Goals, which is aimed at ensuring that we provide a legal identity for all, including free birth registration by 2030. So some of the strategic reforms, again, in strengthening our ID management is the issue where in 2013, we introduced what we call a live capture and e-home affairs platform. Basically, live capture, as you have seen with some of the exhibitors on the other side, is to be able to capture those birth registration, those enrollment online, immediately, no paper, so that we are able to ensure that that particular enrollment is much quicker, the turnaround time is much quicker, and it's also secure and paperless. We have also introduced what we refer to as an e-channel and e-home affairs system, where somebody can start the applications on our portal from the comfort of their own home and then complete the process. So that's one of the achievements that we have made. I think we have made reference to the issue of mobiles on wheels, of home affairs on wheels. In that, as I said, we have increased that footprint. It's a very good project. Last week on the 7th, the president actually launched an additional 100 units in one of the provinces north of the country, where those were unveiled to the citizens, and they've been taken throughout Biggest problem is to work with telecommunication companies to ensure that the coverage issue is something that we don't struggle with, because if we don't have proper bandwidth, we will struggle with some of those things. The last other 4 projects that have been a success, which we are currently dealing with, is the automated biometric information system, because currently we have a biometric, a database that has only fingerprints and face. In other words, but it does not provide facial recognition. So with ABIS, we're adding multimodal biometrics, which includes obvious your iris, fingerprint, palm print, facial recognition, in order to ensure that we are able to secure citizens much better, but also process people much faster. Biometric movement control at the airports to ensure that we capture also the biometrics of our visitors, so that for future reference, the e-visa, we've rolled it out to ensure that it becomes easy for you to apply for what we call tourist visa. Still at very teething stages, there are many issues, but we are able to process clients with that. And also the appointment system at our offices, it has made life much easier for offices to manage the queues, because one of the biggest problems was that people pitch up at our office to apply for passports, documents, but if they are able to have an appointment, so our booking system has made life much more easier and reduce queues in our facilities. So we are moving towards a digital ID policy and legal framework. So the key elements of the emerging DHA digital identity architecture includes the following one, is that in 2017 we adopted a digital strategy or a roadmap to guide and outline how the department should transition as a digital-led organization. We have talked about the introduction of the e-Home Affairs e-channel platform and this ABIS and e-visa system. Financial institutions working together with us to ensure that we secure the identity of persons, and that also they are able to utilize the ID to reduce fraudulent transactions, because in the old green ID book, it was easy to tamper that with, but with the smart ID cards, those issues are issues of the past. And there's also have indicated that in 2022, we conducted a research on digital identity, and the study recommended a centralized digital identity ecosystem. And also in 2023, we launched a 3-year program for the digitization of many paper records. Part of the problem is that dating back to the 50s, we've got records that we still have not been converted to digital format. We're busy with that particular project. Up to so far, we started last year. 29 million of those records have been digitized. We are moving forward as fast as possible to ensure that the 340 million paper records that we currently have can be accessed through digital format. And the DHA is also currently developing the digital policy that will provide for further guidance on the rollout of our digital identity for the legal identity in South Africa. Thank you very much. That concludes my presentation.
Thank you. Thank you very much. Actually, we'll continue with Rwanda. Josephine? Thank you. Actually, you want to use the podium? And here is your slide.
Thank you very much. I'd like to first thank Dr. Atik and the team at ID for Africa for giving us this floor to share about our single digital identity implementation in Rwanda. I'd also like to thank the entire team here, colleagues, ambassadors, for the valuable inputs and exchanges we always have during these AGM meetings. So, in a nutshell, this is our journey. When you look at it, we started with a feasibility study that was conducted 3 to 4 years ago. And we set up a single digital identity task force. This task force is made of technicians, both in IT but also in legal, from various institutions. Some of them are here traveled with us to be able to also see how the identity ecosystem operates. Among them, I might mention the Director General of Immigration and Migration, the National Bank of Rwanda, the Rwanda Utility Regulatory Authority, the Ministry of Local Government, Ministry of ICT and Innovation, the Rwanda Forensic Institute, Rwanda Investigation Bureau, Rwanda National Police, Ministry of Justice, Rwanda Information Society Authority, Ministry of Health, Ministry of Education, IREMBO, which is our government service portal, And we, as needs and implementation progress, we onboard more stakeholders. Recently, we have a technician also from the Rwanda Space Agency because of the geolocation as we are going into massive data collection. The next one was the revision of our law. Our digital identity law was enacted last year in June. Actually, it was the day after the previous ID for Africa. I had to leave early because we had to go to Parliament to approve it. The law actually set up also a Single Digital Identity Coordination Council. This council is made of ministers from 5 ministries: Ministry of Health, Ministry of Local Government, that's the co-chair. It's chaired by the Ministry of ICT and Innovation. We have the Directorate General of Immigration and Immigration, the Director General, the Rwanda Information Society Authority CEO, and we have also the CEO of the Private Sector Federation, and NIDA acts as the secretary of the council. And the council meets at least 4 times a year, but as we are in the deep implementation now, we meet as often as required. The next one is the development of terms of references. We chose to disassemble the entire implementation into smaller procurement terms. So we've developed a few. I think the next slide I will explain further. And now we are deep into procurement process, which in parallel is with some few implementation that have started. In the next coming months, we're going into the deep implementation rollout and the development of use cases. These are the milestones, as informed previously. So for the procurement, we've already done the feasibility study to digitize the civil record, because we wanted to know, to take stock on how many records do we need to digitize, and the status and the quality, and also the tagging them by location, because it was going to help us during the implementation. We are into the contracting of the biometric kits. Actually, they will soon be delivered. We've set up a call center, which is really helpful, because not only we are able to interact with citizens, but we believe that even during implementation, it will help people to manage the challenges and the gaps that we see on a daily basis. But today, the call center mostly handles ID-related cases from citizens. We did our national PKI assessment, which led to the development of the NPKI upgrade tender, which already has been published. It's currently ongoing. I encourage the member in the public, whoever is interested, please go on our portal, Umucho, and you'll get it there. We've contracted the pre-enrollment system. This is a particularity of Rwanda. We looked at how to work with various stakeholders and the available databases in Rwanda to collect their data, so when citizens are going to provide the additional biometrics, they can also validate their information without carrying supporting documents. So when they go for the enrollment, they will do first a pre-enrollment. So we'll be able, when you put in an identifier, you get multiple information from multiple databases, and you confirm the one that really matches your particulars. Currently in process, we have the EBIS upgrade is also ongoing. We've launched our core SDID tender. We actually conducted a market info last week, and we were really ecstatic with a number of enthusiasm from the vendors that called us. And the next one will be the AMBAS, which is the authentication modality biometric system. Now, these are the strategic architecture choices. Those you see in big bold are the principles that we really adhere to. We are looking at having an open standard. That's what guides us. We use RESTful API, not only to align with modern web services, but also our ecosystem is actually used, even today, through our integration, we use RESTful API. We want to anchor our implementation on innovation and to empower the data subject as much as possible so that we ensure consent is collected at all touch points. There are some principles our government also is encouraging, which is declare it once, meaning any event, any activity that a citizen declared to the government. They declare it only once in their lifetime, and the entire ecosystem now will have to rely on this single source of trust on identity information, so that we do not have to prove or inform, yet it was done once. We also have the zero trip, zero paper. This is enabled through our government portal, because today we have more than 600, I think, services now on eRainbow, some on payment and some end-to-end. These are the safeguards we're looking at. We're looking at identity. Today, the ID is issued from 16 and above, but with the single digital identity, we want to issue it from birth, and it's linked to our birth registration. For information, we have modernized completely our CRVS system with all the 9 vital events in Rwanda, and it's end-to-end digitized. So it's easier now to go into the digital identity knowing everybody who's born on the land. We produce a vital statistic report. I think I encourage you to go on our National Institute of Statistics website. You'll get the previous year report. We are really happy with the progress that we are making, with timely registration down at 3 days, completeness at almost 90% now, and even death registration is now increasing. We have the system integration. Our current ID is integrated, but we want, with the digital identity, to even further open up the integration and include now triggers. What you're looking with triggers is because the ecosystem, they request and then we provide the information. But we believe that to adhere to the zero trip, zero paper and declare it once, we also need now to set triggers through our integration, so that should any event be of interest to anybody in the stakeholder ecosystem who's connected, they are able to get that information as soon as it happens. Because otherwise, they have to wait for that data subject to go inform them, then they come and confirm. So we want to be actually, since we know it, we push it to the stakeholders, but anchored all on the consent of the data subject. We are also looking at the use of trusted introducer. This is our digital identity law now has expanded the coverage. We used to issue ID to Rwandans, foreign residents, refugees, and today we are looking at, with the digital identity, to expand to include stateless, to include migrant workers, to include asylum seekers, because we've seen that to get the refugee status, it takes time, and during that process, these are asylum seekers, and they are not identified anywhere. So we want to ensure that everybody on the land can be easily identified, and those who are left out because of many reasons with no proof of existence, we will be using an introducer with a digital identity to be able to onboard them, so we don't really leave anybody behind. We are using multiple biometrics. Today we were taking only the thumbs. We are looking at 10 fingerprint, iris, and those will be used for deduplication, but for authentication, we'll use them plus the facial. The facial is not going to be used for deduplication. It will only be used for authentication. We are using multiple forms. I think even the previous panel informed it. We are looking to use the SDIN, just the number, the SDID token. This is to allow in the users, in the empowerment of the data subject, to not always use their SDID number in all transactions. They can be able to generate as much as they want an SDID token and use it on behalf of the SDID number, and also have an SDID card. But we truly believe and encourage that with time, we will reduce the reliance on a physical card and go completely digital. And for security and adherence to our data protection, we are going to also ensure encryption, access controls, and auditing. These are the lessons learned. The stakeholder engagement is very, very important. It enhances communication, risk mitigation, but it also aligns with the expectation, because the ID is not only for the identity agency, but it is to be used. So if it needs to be used, we need to hear from the stakeholders their wishes and their needs, and then we incorporate them into our implementation. We also have the implementation structure. I've told you already about the Coordination Council and the Technical Task Force. Some of them are here in attendance. We have prioritized implementation. I think we have limited resources and time, so we need to prioritize. So we looked at how to optimize the resources, risk management, but also align with the project objectives. We've now, for the implementation, to make sure that, because we've cut down the procurement into smaller pieces, and this means we bring in a lot of solution providers. So we want to manage them. We are hiring an expert firm. We call it systems architect, and they actually supporting us during the implementation to ensure that all the deliverables are aligned with the requirements and standards, and also to ensure that it's scalable, it's optimized, and we are adhering to the standards, because as I told you, we are really emphasizing on open standards. We do not want to lock ourselves into any specific implementation. And also, we believe that having such a firm, an expert firm, we are bringing in expert and impartial perspective that does not lie on the sentiment. So we use, it's a neutral organization, and they are coming to help us into this journey, and also ensure that when we do system acceptance, they bring the best technical expertise to ensure that really our vision is implemented as along the way. And as part of their deliverables, they'll also be able to also provide guidance and what are the future implementation models that we've looked at for the sustainability of the system. With this, I would like to thank you very much for your kind attention and open to question and answers.
Thank you, Josephine. Just reminding you that Slido is on, and we will be taking questions at the end after the two ambassadors speak. Now we're welcoming Sierra Leone, Ambassador MASSAQUOI. You see, you can vote on the questions, so please keep voting, keep asking, and we will have time to answer. Please, Ambassador.
Good morning, distinguished ladies and gentlemen. We are presenting our journey in the digital landscape in Sierra Leone. And you will see from the presentation, we have had reason to start our journey from, let us say, with major events occurring, beginning with 2008, where we realized that the registration, the CRVS system and ID management system in Sierra Leone was largely fragmented and performed by different institutions in the country. And so, for instance, in 2008, we had the National Registration Secretariat largely managing identity cards and registration. And then going towards 2010, 2014, the government and partners realized that that was causing a lot of waste of resources and unreliability of information on our population. And then government had support from partners, UNDP and the rest of the others, and we had a review of our system, an assessment of the CRVS landscape, where we discovered that because of those duplication, fragmentation, and then it was causing a lot of loss of government and people. And then government adopted a policy on the national reformation of a CRVS system in Sierra Leone. And we are blessed to have had Dr. Atik seated here to have led the team to assess our CRVS and ID management landscape in Sierra Leone. And given the good work they did, government adopted the policy as it was recommended by Dr. Atik and his team. And then going towards 2016, what government now did, having the policy in place, government now established the National Civil Registration Authority that manages all of the events characterized that are considered to fall under civil registration, vital statistics, and identity management. So the NCRA manages the integrated CRVS and ID management system, and then once it was established, and then today now we have an integrated CRVS and ID management system, allowing the NCRA to manage and account for all CRVS and ID-related functions in Sierra Leone. Now, with the integrated CRVS system, we have, of course, the CR aspect of it, managing the births and deaths, divorces, adoptions. These are events performed before by other institutions of government. And then, of course, we have the occurrences and the characteristics of those events and ID itself. We attempted to highlight a few benefits of these ones once we had them integrated that has largely eliminated conflicts in mandates of government institutions managing the functions in the past, and then that has guaranteed the credibility of our data on our population, and has continued to serve as a single source of information, personal information on our people. And then, of course, that has eased collaboration among stakeholders in the country, thereby also enhancing interoperability and easy access to services. Largely, because of this integrated CRVS system where we now have one-stop shop on the population data, now that has helped to support government e-services. Now, this is just for you to see how it's operating there. Typical look at the INCR, that is the Integrated National CR System, managed by the NCRA at the center there, supporting all of these functional ID institutions or systems. We have supported for the last two elections in 2018 and 2023. Our CR data was extracted to develop the voter register, and we are also supporting other institutions for issuance of vehicle registration, issuance of driving licenses, supporting the tax administrators so that the people don't evade tax, and as well as supporting consular services in verifying identity credentials presented to them for various opportunities. We're supporting the Ministry of Health with identity information of people, the pension scheme, the immigration and travel opportunities, and of course education and a host of others. That's typical of what our support to the system, to the other functional systems is happening in Sierra Leone. And with all of this, one critical element that we've used to support our work is the use of the NI, the National Identification Number. Over there, we call it the magic number. You don't escape it. We use this in 2018 to clean the government payroll, a system that successive governments in the past tried to do, but we are very much unsuccessful. But in 2 months, we were able to clean the payroll, and we track over 9,000 ghost workers in 2018. Since then, 2018, government now made it a policy that for any enlistment into government institution, you must have your NIN, your identity must be cleared by the ID management system at NCRA. And then the NIN, of course, is now mandatory. Government has made it mandatory for to access services in Sierra Leone. You want your passport, you want your driving license, you want to register a business, you want to join the social security scheme, you want to establish to open businesses, etc., etc. You need the NIN. That has helped so much in assuring accountability in service delivery and governance as a whole. So this is the progress we have made so far. Like I said, before 2016, that was before Dr. Atika and his team had the assessment on our CRV system. We had, because we are merely focused on registering people for ID cards, it was very low. You can see in 2016, 7%. And in 2017, Havon established the authority for an integrated CRVS system, capturing all of those events on the civil registration. We launched a campaign, both mass and civil. Then we are preparing for the election in 2018. So having those two campaigns done together, we had an enrollment of 70%. And beyond that, in 2018, of course, when we had the elections, then we had the payroll clean. Then we had the 2019-2021, where we had a vast campaign for confirmation of personal information we had for the last years. That also gave an opportunity to people who had not registered to register, and then it increased to 85%. And before the conduct of 2023 elections last year, in which case our data also was used to support the Electoral Commission to develop the voter register, then it increased to 90%. So today we have barely about 90% of our population enrolled in the system, and all of them have the NIN. And this is the category of our registration data. We now have about 10% to capture, and those ones we have made sure that we are now getting the collaboration of the traditional leaders in communities, and so that those events that occur there, cannot go unnoticed. We'll record them. You can see, and by 51%, 49 male and female, and of course 62, 30% of adults and children. We have 90%, 49 male, 51 female. All of these ones are those that we have done so far. We have upgraded our ECRVS, our CRVS system, capturing all of these events. We've had EU support. We've had the Tier 3 primary data center that is stored locally for security and country ownership of our data. And then we have just concluded a pilot with MOSIP. We have now agreed, we have identified models of interest. We are very much hopeful that after our meeting here, we will have engagement with MOSIP to move the rest of the initiative forward now. Interesting areas that have our interest to us, we'll meet and agree that we'll move that forward using the MOSIP open source system. Our demographic data captures those ones of gender and address, contact of people, and of course the 10 fingerprints, face, and signature of registrants. Like I said, all services now in Sweden are linked to the NIN, beginning with school registration, business registration, tax registration, immigration services, work resident permits, everything in Sweden. We have made sure that it's a deliberate effort to make sure that we are able to account for our population, and we are doing this also in partnership with a couple of other institutions. We are using the API to do verification of our people, particularly those ones as they present themselves to foreign missions for opportunities, and we must have consistency in the information of our population. And our system is consent-driven, of course, and transparent, auditable. Like I said, we're using our data to support the Electoral Commission, so of course, yes, the information must be auditable. And we have had calls to make sure that we have increased access to services to our people. So all of these ones are linked to the NIN, doing the same registration, so that there is no abuse of communication in Israel. Every communication is tracked, and we are able to account for that. Also for enrollment, we are working with the Financial Intelligence Unit to combat money laundering. All of those ones that are bearing with criminality. We are using the NIN to support these institutions managing those aspects of governance in Israel. These are samples of the IDs that we have commenced production. The ID cards, we are producing ID cards for our citizens, and ECOWAS, that is on demand, ECOWAS citizens resident in Sierra Leone, and of course the non-national ID cards for residents, non-ECOWAS citizens that are residing in Sierra Leone. That's very key for you to have your work permit or resident permit in Sierra Leone. You must obtain a non-national ID in Sierra Leone. And then we also introduce the use of securitized credentials. That's a birth register, a sample of the birth register certificate. You see embedded there is the NIN that we're using to track people from birth. And we have had reason to identify a couple of lessons that we are learning in the process. We have relied very seriously and have enjoyed the strong political will and support from government of Sierra Leone at the highest level. You come to see a testimony of it, and we are working with stakeholders, collaborating with them very seriously in all of what we do in terms of civil registration and ID management, and we have been able to harmonize our policies and laws, thanks to, again, Dr. Atik and his team that did the assessment, and we have continued to raise awareness among the population so that they see the benefits of civil registration and ID. Just a sample of how we go into communities to engage our people so that they report the occurrence of the events so that we are able to account for them. And
play the video.
This is just a highlight for you to see that the political support we say we'll get from Sierra Leone is at the highest level of the presidency. And it's not only announced in Sierra Leone or in ECOWAS or AU, it's at the highest level of the UN General Assembly. You will see how the assurance the president gave.
AV, could you please play the video?
Through partnerships and innovation, we have made great progress in establishing legal identity and birth registration by strengthening our national civil registration and vital statistics systems. We have also enrolled national digital identity platform that will help children, citizens, grant access to approved institutions to digitally verify their identities. Governance, development planning, financial inclusion, and human rights imperatives, among others, guide our initiative to establish legal identity using a singular, securitized, and serially numbered instrument. We can also use the same instrument to strengthen healthcare planning, health information systems, disease surveillance, and monitor health interventions and outcomes.
This is only said, it is done in Sierra Leone. Thank you very much for your attention.
Thank you. Actually, I want to add a little bit of background to this. Stay on the stage. Actually, we talked here about political will, but in fact, when I came to Sierra Leone for the first time, must have been 2014, 2013 perhaps, 2014. What I felt was a national will. What was incredible is the determination at all levels that you started with nothing.
Yes.
And you had the determination to say, we will get this thing done. And I felt it. And at that time, I knew you were going to make it happen. So please allow me to congratulate you for a job well done. Thank you. Thank you very much. National will, independent of the political power, even though we call it political will, irrespective of who's in power, it's the administration all through the chain that needs to be supportive of this idea. Okay, now we would like to hear Liberia before we go into Slido and start having discussions. Please, Ambassador Zeze Reed.
Good afternoon. I bring you greetings from the friendly people of Liberia. Dr. Ati, I want to thank you and your able staff for having granted us this permission. Just briefly, the legal framework. An act by the legislature was passed in 2011 establishing the National Identification Registry and giving them certain mandates, and those mandates are listed to ensure existence, that is by capturing fingerprint. You ensure uniqueness, that is due duplication of all of the data to eliminate duplication, and also you ensure traceability, that whatever ID card or number that you issue is traceable to that person for which that ID card was issued. And at the end, you create a seamless integration platform where the ID card will be linked to government and non-government institutions. Based on that, the mandate from the national legislature, the National Biometric Identification System of Liberia was created. Presently, we issue 3 types of cards. If you look to the far left, the bottom part, those are the cards that we issued for infant from birth to age 6. And the top one is for citizen ID card, and the greenish one is for resident. I heard the discussion of citizenship coming into play when it comes to identification. For us to issue citizen card with different color and legal resident card with the greenish color. Presently, we have 15 counties in Liberia, and we have permanent enrollment center located in each of the counties, and attached to the permanent enrollment centers, we have mobile enrollment that go around from village to village. Instead, if the people can't come to the permanent center, we do around where the mobile enrollment go up to enroll people outside for those that cannot afford to come to the permanent center. And we have 2 modes of enrollment. We do enrollment online, and we do enrollment offline. All right, because of the issue of connectivity, we do enrollment offline. That is, you are enrolled, and the data is encrypted from end to end until it's sent to the central office. But where we have connectivity after the enrollment, the record is updated to the central office. We do centralized processing. Centralized processing in the sense that before we issue your card, we have to deduplicate, that is your fingerprint. We have to be compared with the database to ensure that you are not in the system before the ID card is issued. So whatever, if the enrollment is done online or offline, it's loaded up to the central office for processing. These are the enrollment options we have. We have the mobile kit. They have a trunk with the different equipment attached to it. And also we do enrollment now using the smartphone, all right? You can enroll from any part of the country, in the village or whatever, using smartphone. And from the two of them, you can do enrollment, you can do renewal of cards, all right? We do enrollment using the 10 fingerprints, all right? But for the 0 to 6, we skip the fingerprint because of the difficulty in capturing the fingerprint and also the quality of the fingerprint. But for 0 to 6, your card is valid only up to you reaching age 6. Upon reaching age 6, your card will have expired. Then you have to go back to the central office or whatever enrollment center it is for them to capture your fingerprint and then do the deduplication. Yes, you are not fingerprinted, but your card from 0 to 6 is linked to one of your parents who is in possession of the national ID card. So it's something like a family tree. From 0 to 6, you are linked to one of your parents who is already in our database. And when you reach the age 6, your card will have expired, and you come back, and then we'll renew your card, then we'll capture your fingerprint into our database. And also, when we set up the system, we had the hope of linking it to election. So we also collect election information, such as the county. Everything that has to do with election, we capture it at the time of enrollment. All right, here is just a quick picture of our workflow. If you look at the top, you have where you fill out the application form. Then after the application form, there's an interview because we are issuing 2 sets of cards, citizen and resident. So there's an immigration office at each of our central permanent center where you go through an interview with the immigration officer because they are close with the authority to establish citizenship and also residency. After that, then you go and have your data process, capture all of the information, and you go and pay. The card, for now, the card is processed for the fee of $5 United States dollars. And after all of that is done, the first 2 lines, you can do them offline or online. After that, the card, the information is sent to the central office for processing. There where you see the dark brown lines, all right? The first thing here is your data that is captured is deduplicated. If the founder is unique, then a unique number is issued to you, all right? And then a card is printed and given it to you. Once you get the card, then the last one is dispatching. Assuming we did enrollment outside of the central office, we batch the card off and send it off for dispatching. 6 months ago, we launched the digital platform. So like I said, we can now use the digital, your smartphone. Right now, we're using the Samsung S14 to do both enrollment and renewal, all right? And you can also download a digital platform where you can carry your ID card on your phone, all right? And you can also use the form to do verification. It will come in the next slide. So we're going to complete, we are digitized already. You can enroll, you can renew, you can carry your ID card on your smartphone. All right, here we have interface for data sharing. We have the provision, we have an open source system. So we have the provision to create API for whatever institution that wants to link with us. Presently, we have an API for the Ministry of Finance. These are the people that process government payroll. So they use that to clean the payroll, to take duplicate of the payroll, and even the LRA, these are the revenue agency in the country, they use that in the issuance of TIN number, tax identification number. And we also have the telcos. The telcos now are using our verification platform in registering SIM cards. So whatever agency that is interested, they come to us, and after this discussion, we develop the API. Right now, we are in conversation with Ministry of Health in there trying to link our system to birth registration. So our system is an open source that allows for API for whatever institutions that want to share data. And we have a strong verification platform. If you look there, once you can verify either by presenting your card, that is the card I will issue to you. If you do not want, if you do not have your card, and you went to a vendor and they want to verify, they can also verify by using your fingerprint, all right? Ministry of Finance, when they're doing the payroll and they want to do payroll audit, they can go to the different ministry or whatever and do individual verification by using fingerprint, all right? And we get any provision to also do batch verification. Maybe you have an institution with tens of thousands of people and you do not want to verify each of them on the payroll one at a time. You have the provision to do batch verification. And that's the information you get when you go for verification, the EKYC. All right? There's nothing that goes on with all challenges. These are some of the challenges that we have. We have right now a very full coverage ratio, and resulting from what? Like you see the second we said, what? Compliance issue. When I listened to my friend from Freetown, when the president spoke, he made it mandatory for you to use your national ID card for whatever government services. But for us, the compliance is an issue. All right, our government has not enforced the compliance. So because of that, there where you see our coverage ratio is just right now at 14%, and also funding the ID card project. This goes mainly to most of our international partners that go to the country. Instead of supporting the foundational registry, a lot of them support functional registry, and functional registry are limited. So you take the money and develop functional registry that they cannot sustain. So we stay in discussion with them. I think for now, I'll stop there and wait for questions. Thank you.
Thank you very much. Okay, the moment you've been waiting for, so we're going to do Slido. Put up Slido back on the screen, and we are going to start with one quick question to get the pulse in the floor. And that question is a simple one, but in fact, it does relate to every single one of the presentations that you've heard. So I'm going to launch it. Are you seeing it? So this is a poll. Please vote. And the question is, should linking national identity to birth registration be made a priority at this time? AV, could you please, yes, here it is. So let's keep it going. Should linking national identity to birth registration be made a priority at this time? Every one of these identity authorities have actually linked their birth registration to their national ID. So that's the strategy that they have adopted, and so we want to know the sentiment in the floor. should national identity be made part and parcel of this birth registration? Okay, nothing surprising here. The overwhelming majority of you believe that we need to get birth registration, civil registration, and national ID integrated. So that's a good outcome. I strongly believe that as well, but you spoke. Okay, let us now ask some questions. Go back to the active Q&A, please. And let's ask some questions based on Slido to our esteemed panelists. The first question I want to do is for all of you together. And the answer is yes, no. Don't need to elaborate. Does ID authorities implement a right to forget, where citizens can request for deletion of their data whenever they decide? So, yes or no? Right to be forgotten. Actually, we start with South Africa, we go. There's no right or wrong. It's just a question. Do you have the right to forget?
Yes.
Yes? I can say delete me.
Well, you can amend your record, but you cannot just delete because you then become invisible.
You become invisible. But you do have the right to forget. I'm putting him on the spot.
Let me think about it.
Josephine, do you have the right to forget?
Today, no, but in the single digital identity, we have the right to activate or deactivate. Not forget, but activate or deactivate.
Or deactivate, okay. Sierra Leone.
You have the right, but again, I would say you don't have the, you cannot. You have the right, but you cannot. Because every right has a limit.
Okay.
You give your information, that's your right, but government that has the responsibility to take care of you, that protects your life, has the responsibility to also know that you exist or you don't exist. And government has to account for you. So you can say, yes, delete it. Government can say, no, because I need to know about you.
Okay.
So you have the right to and not to. Thank you.
Okay. Liberia, do you have the right to forget? To be forgotten, let's say.
I would say, where your rights stop, there will another person's right begin. So I would say, no.
No. No, you can't go invisible. Once you are visible, you can't go invisible. Okay, so let us now move on. There is a very popular question. I don't know why, but it's very popular, and it's for Rwanda. And Rwanda, the question is, are there any studies or projections on the impact of identification systems on various sectors, specific economic advantages? Have you made any studies to show your members of parliament or your government the impact of identity?
As part of the feasibility study, we conducted an assessment, but we believe that as we continue implementing, we need to bring up more, because impact assessment is what convinces decision makers, politics, even financing any project.
Yes.
So yes, we do it.
Are these studies public or they're just internal government use?
Internal government use now.
Okay. Okay. So now I'm going to South Africa. And this is a very popular question. They're asking what is or are the reasons why only 30% of the population has received a smart card? What is the most successful use case that makes use of the chip?
No, thank you very much. So let me just first indicate it's not 30%, because as of last year, we had about 60 million people in South Africa. Now, of those who are eligible for getting an ID, that's about 40 million, because remember the others are children who are not yet eligible for an ID. So those are between the 1 year up to 16 years. And then, so the 24 million smart cards that we are referring to, if you look at the numbers, it's actually over 50%. If you look at 40 million eligible versus the 24 million that we have issued. The second part is that definitely our smart ID card has the chip that can be utilized for various reasons, integrated services. So we've been talking to our partners at health, at driving license, to be able to utilize that chip for the purpose of keeping those digital records there. we've not been able to finalize all the necessary discussions with transport, particularly for the license, because the size of the chip versus also the design on the card needs to meet the standards. I'm trying to remember now.
ACAO standard?
Not ACAO standards. ISO standards. Yes. So because it requires that it must have an expiry date and things like that, but our smart ID card does not have an expiry date. So those are some of the limitations that we currently have. We currently have also the fact that the picture on the card is grayscale, so they want a color one.
Polycarbonate, laser engraved.
Yes.
But do they pay for the card, the smart card?
Come again?
Do they pay for the smart card?
Yes, they pay for the
Isn't
smart
that a factor, perhaps, why people, only 30% got the card? It's not your ability to issue them, it's the fact that they're not claiming them, right?
Yes, so just to indicate that the issuance of the smart card for the first time is free.
First time is free?
Yes, it's
Okay.
only when it's a reissue. So that's a challenge that we have. But we also have a lot of those that have been issued, not collected.
Okay. Okay. A difficult question for Sierra Leone, and it says, how do you manage user consent about sharing their data when executing a centralized KYC transaction? It seems like the authentication system that you have is a centralized model. So how do you get user consent for that? Or maybe there is no user consent.
Well, it's designed in a way that before your information is shared, and then you have there's a provision for you to give your consent that okay, for instance, if you go to the bank, for instance, and you want to transact a business there, and then the bank has to verify your information with the main system there, and then that is where you provide your consent. And how we went about it, we made sure that all stakeholders were involved in providing services for government or in the country are part of the process of designing the process, the platform, and how it will work. So when you go there, they will encourage you. It's open, and you are aware that you have to give yourself consent before it is done.
Okay. Okay. One question for Liberia. And since you talked about two ways to enroll, which is offline and online, and they're asking is, how do you manage the security and regular sync or synchronization for the offline toolkits? How are you making sure that those don't fall in the wrong hands? And how do you make sure they're always synchronized when they're brought back into a center? Could you describe that process?
For the offline, like I said, the data are encrypted from end to end. All right. For the offline, the data is stored on any media. It can be a pen drive or whatever it is. Because it's encrypted, the key located, it will be decrypted at the head office. So they are sent manually. All right. Anybody can take, one of the enrollment officer can go along with whatever storage medium they have. They even carry the phone, the mobile phone, and then take that to the head office, and at the head office, they will offload it later, the data, and that's where it's decrypted. All right, once you enroll, the data are all encrypted, even assuming that smartphone fed into the hand of an unauthorized person, because the data is encrypted, they won't have access to it.
Right.
That you only have access when that mobile phone is taken to the head office, all right, and through the offloading process is decrypted, and then they have it processed.
But does it happen that a device is lost, and therefore, even if it's encrypted, you have 50,000 people who enrolled who got lost? Does that happen at all?
We have not experienced that, but
we
have not experienced where the equipment got lost, and then we have to. The only problem will be, assuming it happened, you just have to go back to re-enroll. But most of the time, the offline, majority of the time, is done for institutions, all right, and then we can go back to the institution and then just re-enroll or renew their cars. We really have not had an incident where the equipment got lost and we couldn't find the data.
Okay, so you've been very cautious then. There is no procedure other than being cautious with property and making sure laptops and devices that contain data are well looked after. There's a question up here for Rwanda. How do you capture and maintain a biometric identity from birth, considering that the biometric changes significantly between 0 and 10 years old? Perhaps you can clarify this issue.
Yes, thank you. When we collect biometrics, we only take the photo from birth, but the fingerprints, iris are collected from 5. And we also have various touch points throughout the lifetime where one has to go and update their biometrics. So that's how we plan to update biometrics at different stages in a lifetime. So we do not collect it once and keep it for life. We have touch points where we update.
Okay. I want to address a topic that is sensitive, but it's a topic that's important that we discuss. There are several questions specifically for South Africa, but I will broaden it. I'll broaden it for everybody based on a live poll. Let me issue a live poll, and then I will connect it to the questions that were asked specifically to South Africa. So let me launch the poll. Operator, please move to the poll once I launch it. Okay. And the poll is about gender-neutral ID policies. As you know, South Africa has adopted a gender-neutral ID policy. And the question was, should implementing gender-neutral ID policies be a priority for lawmakers at this stage? So let's keep this going. We want to hear from all of you. This is a very important topic. We may not all agree on it, but we need an honest assessment of where the sentiments are. Okay? So, should implementing gender-neutral ID policies be a priority for lawmakers at this stage? La mise en œuvre de politiques d'identification non sexiste devrait-elle être une priorité pour les législateurs à ce stade? Okay? See, the room goes quiet. We have 167 votes. I will stop this at 200. So let's get your input. Let's get your input. And then I'm going to then ask South Africa, you adopted a gender-neutral ID policy. What motivated it? What drove it? I think you may be the first one in Africa to be doing this. Could you please address that issue?
No, thank you very much.
We reached 215. I think we're saturated. Stop the poll. You can take photos of it if you like, but, you know.
Yes, no, thank you very much. So I think we have been having a lot of cases in court. Some of the policy changes that we have made were informed by some of the court judgments. For an example, we had a case here in the Western Cape where there were couples that were married, male, female, and females. But when the male changed their gender, they then wanted to remain married to their spouses, even though there was gender change. And in that case, we lost in court because our system, what it does, it then nullifies the marriage immediately when you change the gender in terms of your number. And then in that particular case, we also met with a lot of gender activists around this issue. So there's a lot of national debate on it. So we went of the view that there are people also who did not want to be identified as male or female. So therefore, if you want to be able to deal with that issue, we've had to then have a policy discussion. Unfortunately, when you are dealing with public policy, the views that emanates from the public ought to be taken on board. So currently we don't have a legislation yet. We have a white paper on official identity, and which we are still processing the legislation. We will introduce that legislation in the 7th Parliament after the elections, because the current Parliament, we couldn't introduce that legislation because there was still a lot of internal consultation on the matter.
The question was also talking about how does that impact the civil registration system, because the civil registration system, you will have to declare the sex of the newborn, either male or female. How will that relate to when you declare what your gender is?
Obviously, the system has got to be adjusted to adapt to that. In other words, like I think it was Rwanda at the beginning, they talked about the unique person identifier. Okay, Kenya actually. Earlier, so where you issue a unique number, not based on gender, but it's a person identification number.
Right.
So those are what we're looking at.
So it's possible that the unique ID number issued at birth will belong to, let's say, a gender male that later can be changed to gender female at some point with the same unique number. You don't change the unique number, right?
That's correct. That's where we need to move towards getting the unique number.
That's how you're implementing it. Okay. Let me take a question for Liberia. Liberia, what happens to those without 10 fingerprints? Is it not discriminatory against persons with disabilities?
Come again.
Yes. What happens when there are people that don't have fingerprints? They're asking, isn't it discriminatory against people with disabilities? Please.
What we do similar issue that is done with the 0 to 5 enrollment. We have them bring somebody, and then we link them. We use that person as an introducer, and then we also take the picture of them, all right? Assuming you amputate that, we take your picture with your hand like that, and then we add that to the record. Or we'll make sure you are linked to one of your relatives, so just in case there's a need to get back to you where we cannot find a fingerprint, we can get back to whoever we use as introducer. If you look at our form, we have a space called introducer. In Liberia, most of the time in a rural area, you have people that do not have documents. So then we look for people, say the town chief can come and introduce that person. All right, and then we can use the town chief information once the town chief is in possession of the national ID card, and then we link that person to the town chief. So we do similarly with people that are amputated. We have one of the relatives, but we take their picture, and then on the form, you have to indicate why the fingerprint is not captured, because when you're processing the data, you go through a process, and when the fingerprint is missing, you have to select the option that the fingerprint is why the fingerprint was left off. Okay,
so nobody's left behind. Even if you don't have fingerprints, you're able to do exception handling for them. A question for Sierra Leone. In fact, somebody was pointing out, do all services require a NIN? Because they're seeing that 10% of the population is unregistered. Does that mean they're still out of the services from the government?
Services in Sierra Leone now, for the last couple of years, are tied to NIN. And it's mandatory. You have to have your NIN, and that has helped a lot in ensuring that we have a system of accountability and efficient public administration, especially since we clean the payroll and of government. So that is it. The NIN is used. For those ones we have not had, the 10% we mentioned, we are making conscious efforts to accommodate them. And then when they want the service, anyone with services inside, they ought to first contact the civil registration authorities where we are captured, and then their information is available for the services they want to access. But you can't escape that in any case.
So maybe I'll launch a poll, and then I'll come back to you with that question again in a different way. And I want to launch a poll. Operator, please follow me, and let's launch a poll. Show it on the screen. And the poll says, should the adoption of policy requiring the NIN, or the unique ID number for accessing services, be a priority for lawmakers? So we're talking about, should you make this a priority so that people should get a national ID number or unique ID number in order to access services, okay? And not only by law, we've seen Sierra Leone and Liberia both have laws saying you should have a unique ID number. But in Sierra Leone, the enforcement seems to be more than in Liberia. So the results, we see higher enrollments in one country versus the other. So should the adoption of policy requiring UID for accessing services be a priority? Okay, we keep voting, but it's clear that this is going in this direction. Basically, 88% of you are saying, yes, we should have laws that require services to be linked to unique ID. So let me ask the question to all of you in that case, what is the risk of exclusion? If all services require a unique ID and somebody doesn't have a unique ID, do we risk exclusion? And if we do risk exclusion, how can we address that concern? And that's to all of you. How did you do it? We can start actually with Josephine. Josephine, if unique identity numbers are required for service access, do we risk creating exclusion for people who don't have it? And how do you address the exclusion concern?
Yes, it might, but I think coming up with the strategies such as the introducer allows actually those who were left out for many reasons, because we need to know now why are they not part of it, and then we see how to close those blockers so that they are also issued an identity, because having an identity is not a fancy thing, it's their primary right, and we need to make sure that all the blockers that do not allow them to access such their primary right are opened. So like in our identity law, now we also introduces the introducer, which is somebody within the community who has an identity already, who can vouch for somebody else who have been left out for so many reasons, but because they do not just have a document that says who they are, right, they have been left out for many reasons.
So what you're saying is that yes, they still need to get an ID, but we are accompanying them. We're having the introducer system, just saying, you don't have it, no problem, services require it, but we are going to give it to you as we give you services. Okay, so I come back to Ambassador MASSAQUOI. So how are you avoiding exclusion if you are enforcing the requirement that the NIN, the national ID number, is a requirement for the ID, for service?
In fact, you see that as a means to motivate people to...
So you see it as a motivator?
To motivate people to enroll, to register with government, with the institution. Because you know, if you are not in the system, and then for instance, you cannot obtain a driver license. So you look at the advantage involved in having the unique identification number as against the disadvantage of it. Let's say, for instance, what is it that you can have in the US without your SS? And how has that helped the US in terms of accounting for all transactions in the US and assuring transparency in all transactions? So because of that, you will see that the value the unique identifier adds outweighs the disadvantage it may have in terms of exclusion. That brings me also to the point of, say, how you design a law. The law, the civil registration aspect you look at the features of the CR, it makes it compulsory. It's permanent and universal. And what holds to those features is that when people are uniquely identified, because the reason being that you want to make sure that you are dealing with Joseph Attic as Joseph Attic. Even though you have thousands of Joseph Attics, but you know this is my own Joseph Attic or Joseph Attic. So what is due Joseph Attic cannot be given to other Joseph Attics. And what is given to Joseph Attic is accounted for.
Okay.
So because of those reasons, you see that it is important to encourage people, to motivate people.
So it's
to
a
have
motivator
That
in
is
your
why
opinion.
ours now is from birth. When you register birth, your birth certificate, there is provision for your NIN, and it's tied to your mother, because you may guess the father.
And this is
but the
why,
mother, the mother's NIN is tied to the child.
yeah. And this is why you sensitize the population. I see you a lot out
We
there.
sensitize the
with
population, and we are
microphones.
working with a lot of other stakeholders involved in the process.
Right. And
if you go to the
IDD
communities, for instance,
Right.
but there is no naming ceremony that is done in the villages, the small
Right.
community, without the chief or the imam or the local priest superintending that. And so also is that. All of those are the events that you make sure that are linked to the NI.
Right.
Just to make sure you account for everybody.
And
precisely and
ID
reliably.
Day is the best motivator to the population to sensitize them. So please keep that in mind. If you want to say NIN is required, ID Day is a good time to remind them about that, which you do actually, which is great. Let me get Liberia, and then I want to go to South Africa with a different question, because we've heard enough, we understand the issue. So Liberia, how do you avoid exclusion when you are requiring a national ID number for service access?
You talk about services. You can, if the government wants to plan, you need information to plan. Even if you provide services, you need information. And in the absence of those information, how do you plan? You want to build schools. You want to build health facility. It's the information that will help you. What kind of school do I build? What kind of health center do I build? Well, do I build it? What kind of health services is lacking? All of those depend on data. And if you do not have them into the system, all right, your provision, your planning could fail, because the number that you'll be looking at, and then you make provision for that number, you fall short of whatever a system you have. And like you say, also duplication of services provided. All right, you could have one person, maybe some medical cash benefit, all right, and you don't have the NIN number, it's not a requirement, all right, and one person could bring 5, 6 person, take those same 6 person, go to another place and get the benefit.
Ambassador, you're motivating the importance of having a number. That we understand, but the issue is not that. We accepted that. The issue is what happens when somebody who's a legitimate, entitled individual comes somewhere and they don't have that number. What do you do to ensure they are not delayed in the service access?
If they assume it's free service, okay, the service is free, it's given free, and
Right.
you decide not to, then the service is not. I won't consider that as discriminating at all, because you are asked to go.
Right. But if the service location is different from the enrollment location, then there is a barrier for somebody. Will you be putting enrollment centers next to service locations? Is that something you consider?
This is what, like I said, I indicated in my presentation. We don't wait for them to come to
Right,
us.
you go to
we
them.
go to them. Okay, we have enrollment centers spread all over. We have mobile teams. So
Yes.
we go to them. If you decide not to come,
Okay.
then you.
Okay, I think we want to
I
move
wanted
on.
to add to help Liberia a bit with an instance. Let's say, for instance, our government has introduced free quality education in Sierra Leone, from elementary, primary, and the secondary, etc., etc. You're targeting about 3 million school-going children. You don't have a unique ID. How are you going to account for that 3.1?
Right.
That they don't duplicate resources that government provides, not only school fees, but also learning materials and school feeding as well. So if you don't have the NIN, you are going to indulge in corruption and abuse in a way that it will have no impact on the lives of the children you want to educate in Sierra Leone. So that is the reason why you motivate them. So
Yes.
bring your children. We're providing free quality
Yes.
education for your children.
So-
but they must have their NIN, and then we enroll them, and then we support them freely.
I think all of you are in agreement that you can't just have laws that require people. You also have to sensitize people, motivate people, reach out to them, and build campaigns to include them. Put your enrollment centers next to where the services are. Don't wait for them to come to you, go to them. So there's a lot of good lessons here. We don't have time, but I have one question that seems to have 9 people that want to know the answer to this, and that's to South Africa. So I'm going to ask it. Why has there been an increase in blocking IDs? How is the system set to mitigate this issue moving forward? they heard it in the media, so I think it's legitimate.
Yes. No, I think the issue of blocking IDs is to enable us to investigate those specific cases where, for an example, somebody has acquired the document fraudulently, and that the only way you are able to do that for them to come forward is when they are not able to utilize that document for transaction purposes. But obviously, through the courts, there's been a directive from the courts that we should rather consider unblocking those IDs and deal with the investigations to its conclusion rather than starting with the ID, because we thought, obviously, that's a mechanism, a deterrent, but it's not provided for in law. So therefore, we have unblocked millions of IDs recently. But our biggest problem is the risk to the financial institutions if someone will then transact with that ID that is currently under investigation. So I think there's one issue.
And do you still have a backlog in unblocking these IDs or vetting them again, or you're working through it?
No, we are blocking them, but also still investigating for those cases, so because we don't want to leave them unattended, because we know, as a matter of fact, that there were many that were acquired through misrepresentation, particularly in the 90s, prior to us introducing your biometrics and other related mechanisms to verify.
Excellent. Okay, ladies and gentlemen, I wish I could take more of your questions on Slido. I think we have about 100 questions. Obviously, we cannot do that because you're hungry and you need to go to lunch, and we need you to have the energy so that you're back here at 14:15, which is 2:15, for an incredibly exciting session moderated by Jonathan Marskill from the World Bank on accelerating impact, digital identity use cases. We're going to hear from 4 countries that have made a rapid breakthrough. We have Philippines, we have India, we have Tunisia, and we have Brazil. So please join me in thanking this wonderful panel here, and have your lunch, go to the networking, meet your colleagues, but please, whatever you do, we would like you to be back here on time. We start on time, we stay on time, so we end on time so you can go and enjoy South Africa, Cape Town. Thank you very much. Thank you.
Africa arise, Africa arise, oh mama. ID for Africa, ID for Africa, Africa arise, oh mama. Africa arise, it is a time now. Africa arise, oh mama. Africa amuka, Africa amuka. Africa amuka, oh mama. Africa amuka, Africa amuka, Africa amuka, oh mama. Wakati umefika, the time has come for every nation to own ID. Wakati umefika, The time has come for every nation to own ID. The time is now, the time is here for every nation to own ID. Kitambulisho muhimu kitatusaidia kulinda mipaka ya nchi. Kitambulisho muhimu kwetu Afrika kitatusaidia kudumisha undugu. The time has come, the time is now for every nation to own ID. Itatusaidia kulinda mipaka, kupunguza uhalifu, kupunguza ugaidi.